Ever wondered how a tiny nerve lesion could make you lose your smile? Today, we're diving deep into the fascinating world of cranial nerve lesions, the hidden conductors of our body's neural symphony.
And what a symphony it is. These 12 pairs of nerves are literally the gateway between our brain and the rest of our body.
You know, I've always found it fascinating how these nerves can tell us exactly where damage has occurred in the brain. It's like having a GPS for neurological problems.
Exactly. And according to the latest research from 2025, understanding these patterns is crucial for NEET PG success. The cranial nerves originate in specific parts of the brainstem, and their dysfunction can pinpoint pathology locations.
Let's break this down for our listeners. What's the first thing medical students need to know about cranial nerves?
Well, the first key point is that cranial nerves 1 and 2 come from the forebrain, while nerves 3 through 12 originate from the brainstem.
Wait, so they're not all from the same place?
Not at all. And that's what makes them so interesting. The brainstem itself has 3 components: the midbrain, pons, and medulla oblongata.
I've heard that some nerves are thicker than others. Is that true?
Yes. The trigeminal nerve, cranial nerve 5, is actually the thickest because it's essentially 3 nerves in one. It comes from the pons region.
And what's the thinnest?
That would be cranial nerve 4, the trochlear nerve. It has the least number of axons of all cranial nerves.
You know, this reminds me of how COVID-19 really put cranial nerves in the spotlight.
Absolutely. The loss of smell and taste highlighted the importance of cranial nerve I, the olfactory nerve. It really changed how we approach cranial nerve examination.
Let's talk about lesions. What are some common patterns students should know for NEET PG?
According to recent studies, diabetes mellitus is one of the most common causes of cranial nerve lesions. It can affect any cranial nerve.
Really? I didn't realize diabetes could have such a widespread impact.
Yes, and multiple sclerosis, tumors, sarcoidosis, and vasculitis can also affect multiple cranial nerves simultaneously.
How do you approach diagnosing these lesions?
The key is to think systematically. Is it the muscle, the neuromuscular junction? Is it within or outside the brainstem?
That makes sense. What about specific nerve lesions?
Let's take the optic nerve, for example. Lesions can cause various visual field defects, from small scotomas to complete blindness.
And these patterns are specific to certain conditions?
Exactly. A bitemporal hemianopia typically suggests compression of the optic chiasm, often by a pituitary adenoma or craniopharyngioma.
What about facial nerve lesions? Those seem pretty common.
Yes, the facial nerve is particularly vulnerable. Bell's palsy is a classic example, causing weakness on one side of the face.
I've heard examining cranial nerves can be intimidating for medical students.
That's true, but it's all about developing a systematic approach. Start with simple observations and work your way through each nerve methodically.
Any tips for remembering all 12 nerves?
Oh, there are some great mnemonics. But more importantly, understanding their pathways helps remember their functions.
Speaking of pathways, how do these nerves exit the skull?
They exit through specific foramina, or openings, in the skull. This is crucial because compression at these points can cause specific symptoms.
Let's talk about the vagus nerve. It seems to do a lot.
The vagus nerve is fascinating. It affects everything from heart rate to digestion. Lesions can cause diverse systemic issues.
That's quite a range of functions.
Yes, and that's why it's called the wandering nerve. It has the longest course of any cranial nerve.
What about combined cranial nerve lesions?
These are particularly important for diagnosis. Certain combinations can indicate specific locations of damage or particular diseases.
Can you give an example?
Chronic meningitis tends to affect the lower cranial nerves one by one, whether it's malignant, tuberculous, or fungal in nature.
That's a really specific pattern.
Yes, and recognizing these patterns is crucial for the NEET PG exam. They love testing these relationships.
What about the historical perspective of cranial nerve examination?
It's fascinating how our understanding has evolved. Early physicians had to rely purely on clinical observations.
And now we have all these advanced imaging techniques.
True, but the basic clinical examination remains incredibly valuable. It's often the first clue to diagnosis.
Let's talk about some practical tips for NEET PG preparation.
Focus on understanding the anatomical pathways first. It makes the clinical presentations much easier to grasp.
Any high-yield topics to focus on?
Visual field defects and facial nerve palsy patterns are particularly important. They appear frequently in exams.
What about rare conditions?
Know the classic presentations, but don't get too caught up in the rare stuff. Focus on common conditions and their variations.
That's really helpful advice.
And remember, these aren't just exam topics. They're crucial for real clinical practice.
Speaking of practice, how can students improve their examination skills?
Practice on colleagues and always follow a systematic approach. Start with inspection, then move to specific tests.
Any common mistakes to avoid?
Don't rush through the examination. Take time to observe subtle signs and always compare sides.
That's great advice for our listeners.
And document your findings clearly. It's crucial for tracking changes over time.
We're almost out of time. Any final thoughts?
Remember that cranial nerve examination is like solving a puzzle. Each finding is a clue to the bigger picture.
That's a great way to think about it.
And with practice, it becomes second nature. The key is understanding the patterns.
Well, there you have it, folks. Thanks for joining us on Co-Pilot Podcasts. Remember, when it comes to cranial nerves, it's all about connecting the dots, just like our neural pathways do.